Hi, welcome back to the comprehensive mental health course for midwives. This presentation, we're going to be talking about your own mental wellness. The lessons that we'll cover, well, what is mental health? Why is it important? Some common mental health issues, promoting good mental health, and finally the conclusion. So, what is mental health? Mental health is about your emotional, psychological, and social well-being. The WHO defines mental health as, quote, a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Mental health is as important as physical health, right? Think about it. You wouldn't go to a birth if you were throwing up, if you had a fever, if you had COVID, right? So all of these things are physical. Well, treat your mental health the same way. Address your stress, address your triggers, address your emotional, psychological wellness as well. So what is good mental health? We're going to focus on wellness rather than illness for mental health. And this doesn't mean that you're happy all the time. It just means that you are able to focus on the good things in life, that you are able to come around after a sad incident. With good mental health, you don't have to always feel optimistic, but you have the ability to feel optimistic. You don't always blame yourself if something goes wrong. And you essentially have good self-esteem. You like who you are. You're proud of yourself. Good mental health, it's more than just the absence of mental illness. It means that you're in a state of well-being. You feel good and you can function well in the world. When you're in a good place from a mental health perspective, you can deal with the negative impacts of stress quickly, easily, and resourcefully. Doesn't mean you don't have stress. It just means that you're able to deal with it. It means that one little stressful thing is not going to bring you to the ledge. When you're in a good place from a mental health perspective, you can perform better. You're creative and productive and motivated. You don't feel as though every day you just want to stay in bed or under a rock. You feel good about yourself and your life. You can sleep better as opposed to having significant mental health issues, and you can maintain good relationships with coworkers and in your private life. So what's poor or unstable mental health? Well, poor mental health is when you can't manage life well. Your reactions and what you think and feel, sometimes you don't have control over. Sometimes it happens in a negative manner. You react in a negative way to daily stresses and stressors in your life. Alterations in thinking and mood or behavior that interfere with your daily activities and your quality of life can also represent poor mental health. Different things that happen, that come across in your daily life are going to bring you down sometimes, are going to make you sad sometimes. But if you're in a good state of mental health as opposed to a poor or unstable state, you can deal with them. You can reach out to somebody if you need to. You can take a day off and focus on your mental wellness. You can go get help at your doctor's office if you need to. All of these things are in your reach when you have good mental health. When you have poor mental health or unstable mental health, sometimes it's impossible for you to reach out. Sometimes it's difficult for you to talk to anybody or really feel like you want to support yourself. Poor mental health and mental illness are not the same thing. A person can experience poor mental health and still not be diagnosed with a mental illness. It can be like a acute problem, like working long hours or maybe caring for somebody who's sick. Sometimes you can experience a hardship, and the way that you act around this time frame may show poor mental health or bad mental health or negative aspects of your mental health. It doesn't necessarily mean that there is a mental health disorder. There could be symptoms of a mental health disorder. Could be a situation that can resolve itself. But again, if you're in that mental health state that is poor or low, you may need somebody to help pull you out of it. So why is mental health important? Well, emotional and mental health are very important. They're a vital part of your life. They impact your thoughts, your behaviors, and your emotions. They impact your relationships, your work, your interactions with your patients, and your interactions with your family. Being healthy emotionally can promote productivity and effectiveness in work, school, caregiving, etc. It can also play an important part in the health of your relationships and allow you to adapt to changes in your life and cope with adversity. You can cope with stress better. You can cope with something that may happen negatively, like somebody getting ill or injured, or maybe losing a job, or having to move suddenly. Being emotionally healthy can help you deal with pressures and trauma in the workplace, such as neonatal loss or an emergency hospital transfer. When you're not in a good place mentally, these things like anxiety and stress and depression, they have a direct effect on your physical health. Include stomach issues and jaw pain and back problems. Do you ever feel that when you're stressed, you have problems like lifting your shoulders? Sometimes they're very tense. You carry a lot of tension there. Also in your jaw, carry a lot of tension as well. You're also at a greater risk for substance abuse, sleep disorders, and relationship issues. So why do midwives have mental health struggles? Well, the long and unscheduled hours make it a lot harder. Fear of making mistakes, especially in states where you're practicing on your own and may not be practicing under somebody that is a legal coverage. So you are more open to liability. There are stresses for mom and baby that you take on personally. The whole balancing of work and personal responsibilities is very difficult, especially with hours and events that can't always be planned. It's burnout. There's sometimes problematic contact with your patients or your patients' families. And again, there can be many more factors, such as physical illness, illnesses of others that you're dealing with, family, legal issues. All of these factors can contribute to mental health issues among midwives. So in the next several slides, we're going to talk about some common mental health problems and help you identify some of those risk factors as well as some of the signs and symptoms, and also help you differentiate between just those signs and symptoms and actual clinical mental health disorder that it is important to reach out for help for. So some of the symptoms that you may notice in yourself that you should really pay attention to. So sleeping dramatically, more or less than usual. So it's a sudden change in your sleeping habits. Your appetite changes that result in unwanted weight changes, and that could be more or less, that you've been eating or just not eating at all. Struggling to get out of bed in the morning because of your mood. Difficulty concentrating. So sometimes you may see problems with remembering things or thinking things, or sometimes you may not be able to discuss something without getting caught up in an issue remembering what you were talking about. Loss of interest in things that you used to find enjoyable, or inability to perform a usual daily function and responsibility. May have a much shorter temper than usual, kind of a shorter wick on that candle. May have changes in relationships with clients. You may find yourself feeling afraid, anxious, nervous, uneasy, or panicked. And then finally, laughing at things that are inappropriate, sometimes at inappropriate times or for no apparent reason. So as I noted earlier, we've got the clinical diagnosis of a mental health illness versus just the symptoms. You can actually present with an elevated level of symptoms, but not meet the diagnostic criteria. You still do need help for this, and you deserve support and treatment, but it's a clear clinical distinction when seeking support if you're looking for specific things like a medication or a psychiatrist versus a therapist. Again, if you're meeting the clinical diagnosis of a mental health disorder, then that will be treated as the disorder as opposed to the signs and symptoms. And if it's just like, for example, you have very sad days and you can pull yourself out of it, it's not clinical depression, but you've been having a lot of really down feelings lately. And so that's definitely something that you can work on, but it isn't necessarily something that you need to go to a psychiatrist for. So you can work on those symptoms. And sometimes you need to talk to somebody to understand and differentiate between that diagnosis. So let's talk about some common mental health disorders. In order to meet the criteria for these mental health disorders, for all mental health disorders essentially, the symptoms must cause significant distress and interfere with your daily life, your social, occupational, and your educational functioning, at least for a defined period of time. Typically it's 2 weeks, but again, it's specific to the disorder. So we're going to talk about several of the more common disorders. Remember, they must be diagnosed by a professional, but they are common and they are treatable. So we're starting with anxiety, as it's the top mental health issue in the United States. And the main symptoms of anxiety is essentially feeling anxious, nervous, or restless. Often you may have an impending sense of doom, like something bad is going to happen and it's about to happen, even if it doesn't. You may have an increased heart rate, fast breathing, sweating, shaking, trembling, or a tingling in your hands or your feet so that your extremities feel like they're asleep. That pins and needles feeling, that's paresthesia. Excessive anxiety can actually make you avoid things and people, places, or events. For example, my daughter had excessive anxiety, and that was related to getting on public transportation or the school bus. So every time the bus pulled up, even though she was nice and calm and happy and ready and got her backpack, let's go, and then the bus pulled up, and then all of a sudden the heart rate gets faster, and she had faster breathing and tingling, and she wouldn't be able to stand still. And it would explain to me that she just got extremely scared, like something was going to happen. And that right there is an anxiety attack, and that could happen from a mental health disorder or just as a symptom in itself, with not an anxiety disorder essentially diagnosed, but having those symptoms that can happen when something sparks you off. Now, depression is another one that is not as clearly understood. A lot of times people will say, I'm depressed, or, oh, I think I've got depression, or assume that depression just means you're sad, and not necessarily. So, yes, if you have a feeling of low and losing pleasure in things that used to be enjoyable, those are signs of depression. Those are symptoms. So the signs, again, is what somebody else can see, and the symptoms are what you're feeling. But it may not be actual clinical depression. So major depressive disorder has certain clinical criteria that it has to meet to be diagnosed. Sometimes there are depressive symptoms, and you can treat those signs and symptoms, such as feelings of irritability or changes in appetite, sometimes changes with sleep, concentration, or memory. With the clinical depression, people usually have negative thoughts, feelings of guilt, worthlessness. They often criticize themselves and lack confidence. PTSD is something that can happen from any type of trauma. It does not necessarily have to be war or death. It can happen from an emotional loss. It can happen from a negative birth experience. Even as the midwife, being part of a woman's traumatic birth can cause PTSD, or it could cause post-traumatic stress symptoms. So again, to actually have the disorder, it has to meet the clinical criteria. But having any of these particular symptoms, it is still something that should be addressed and that can be treated. So flashbacks, constant negative thoughts about the experience, any experience, having nightmares, typically those nightmares that revolve around that trauma. Repetitive and distressing images or sensations, so things that you can see. Just thoughts in your mind, not necessarily like hallucinations, but images in your mind. Physical sensations such as pain, sweating, feeling sick, or trembling. Also, somebody with PTSD may be very anxious. They might find it very difficult to relax. They could be constantly aware of threats and easily startled. That hypervigilance is something that's very common with PTSD. So generally, again, this does have to be diagnosed by a mental health professional, but it usually is about 5 or more symptoms that we had discussed. Typically, they have to occur for most of the day, nearly every day, not just one specific thing. Again, it does depend on the illness, but generally it's about 2 weeks, and the symptoms are severe enough to interfere with your daily activities. At that point, you really should seek treatment beyond self-care, such as talking to a therapist, a psychologist, or a counselor. And this individual, this therapist or social worker, can actually help you to determine if you need a psychiatrist for additional support, which most likely would be medication support if you're going to be seeking a psychiatrist. I say most likely because a psychiatrist can also do some other types of mental health support that a therapist may not be able to do, as it does involve more of a medical aspect. Psychiatrist is going to be an MD as opposed to a therapist or a psychologist, who are typically master's level, or if they're doctoral level, they're going to be a PhD or a PSY. Know that you're not alone. I think that's the most important thing, that when you reach out for help, sometimes you may not know where to reach out. So you can always talk to your doctor. You can always talk to a helpline, and they can help you find somebody that you can talk to, whether it's a mental health professional. Sometimes going to a support group could help, even online. There's a significant mental health crisis among health professionals right now. It's always been high, but with the pandemic, it's shot up the past few years. The American Association of Medical Colleges, one of the senior staff writers, wrote this quote: "The pandemic is threatening the emotional well-being of thousands of providers. But fear of losing job opportunities, fear of losing their peers' respect, even their ability to practice medicine, keeps many from seeking the care that they need." And it's true, it does go on your record, and so a lot of people will not seek the help. But not seeking help is not only significantly harmful to yourself, it's also harmful to your patients and your patient's family. And in the case of obstetrics and midwifery in the patient's baby, which is also your patient. So think about that when saying, I don't know if I really want to seek help. Again, you're seeking help for yourself and for the families that you work with. Promoting good mental health. Self-care. Well, we've all heard about self-care, but what exactly is self-care? Self-care doesn't necessarily mean you're going to go get a massage and get your nails done. And, people picture the spa for self-care and laying back with cucumbers on your eyes. But self-care can also mean things that help you live well, eat well, like lifestyle medicine, worrying about your physical health and your mental health. Not worrying is probably not the best word, but giving attention to your physical health and attention to your mental health. Even if it's leaving 15 minutes earlier when you have to go to work because you're going to walk instead of, take the bus. When it comes to your mental health, self-care can help you manage stress, lower your risk of illness, and increase your energy. Even small acts of self-care in your daily life can have a huge impact. National Institutes of Mental Health has done a lot of studies on this, and there are published evidence that even a little bit of self-care, little bit of changing your routine and focusing on lifestyle changes can make a significant impact to both physical and mental wellness. So regular exercise is one of the big things that's important, even if it's only 30 minutes of walking every day, which could be walking home from somewhere or walking around the block or taking your dog for a walk or walking to drop your kids off from school. Eat healthy, regular meals, stay hydrated, make sleep a priority. That is important, and sometimes it's hard, especially in midwifery. But sleep is vital to a lot of mental and physical health issues. And finally, do a short, relaxing activity every day, whether that's a mindfulness meditation, we'll talk about that a little bit further on, or playing cards with your kid. It could be anything. It could be walking through the park. Just make sure that every day you do a short, relaxing activity. Sometimes there are relaxation programs on your app that might be easier than reaching out to go to a class that might not work in your schedule. But if there's a relaxation or wellness program that may be at your local community center or Y, is great to be part of. But again, even just an app like a meditation app or mindfulness or calm type app where it'll remind you. I actually have an app that's connected to my watch, and when my heart rate goes up, it tells me to take a breath. Breathe in through your nose and out through your mouth. You can also set up time, so every 3 to 4 hours, a reminder can go off that says, take a moment to breathe. And it actually can make a significant difference. Incorporate meditation, muscle relaxation, so like a progressive relaxation, or breathing activities into your daily routine. So as you're waiting for your Uber to show up, or as you're waiting for your client to call you back, things like that. Schedule regular times for healthy activities, such as journaling or walking. And finally, set goals and priorities, and that can help with the reduction of stress and anxiety and panic, and it can help with organizing things and planning things so it flows better. So there is strong evidence to show the relationship between diet and mental wellness, both in the positive and in the negative sense. So there are things that you should avoid because these things such as the excessive amounts of caffeine or alcohol or high-fat dairy are things that can lead to lower mood. They can also help to initiate some mental health symptoms. But also there are protective factors such as a healthy breakfast in the morning, eating fresh fruits and vegetables, making sure you get enough protein, obviously getting enough water, we know how important that is, and then eating whole grains and unsaturated fats, and avoiding the fried, refined, and sugary foods. These can make a significant difference in your mental health. Meditations and relaxations have been used since ancient times to support individuals in their psychological and emotional and physical health. It's only within the past decade or so that we've really come up with documented evidence to support what people have known since the beginning of time, that meditations and relaxations can have significant benefits to stopping the symptoms and alleviating the symptoms of mental health issues, such as the stress-triggered mental health disorders, like anxiety and panic, as well as depression. It can also help individuals manage their triggers to improve their mental and emotional health. Now, on physical, there are things that stress causes, as we talked about earlier, such as the stomach issues, the gastrointestinal issues, headaches, and headaches also come, tension headaches. Sometimes people feel that pain in their temples, temporal mandibular region, so TMJ, that often occurs from stress, such as pain in the bottom of your jaw or grinding of the teeth, clenching of the jaw. These are things that meditations and relaxations can help significantly reduce. In addition, they can help with mind wandering or poor attention, can help reduce blood pressure, and they can bring that inner peace and that calmness to stream together those jumbled thoughts and put together some of the things that may be crowding your mind and, clouding your focus, and actually help an individual to pull it all together and to get through the day. Almost 10 years ago now, I believe it was 2013, there was a randomized controlled trial of mindfulness meditation and generalized anxiety disorder, which showed significant benefits in utilizing mindfulness meditation for reducing the signs and symptoms of generalized anxiety disorder. So when you're not able to call up your therapist or go to a visit or take a nap or take a bath, what can you do at a birth? Because at a birth is an important time to focus on your mental health, as well as the mental health and physical health of the client and her family. So when you're at a birth, there are a few things that you can bring with you, such as snacks, a journal, a sketchbook. And when you have some downtime, it's wonderful to be able to tap into that. Have your own special little bag, not your birth bag, but a special little bag that's got some nuts in it maybe. The protein can help you go. Make sure you put something in there that you like, not just something to keep you going. I know a lot of midwives use beef jerky. I used to bring beef jerky all the time because that's a great source of protein, but think about your emotions and the psychological aspect of it. So instead of just bringing birth beef jerky, maybe you can bring teriyaki beef jerky because that's special and you only have that, let's say, when you go to births, or pomegranates. So pomegranates are something that are fantastic as an easy, quick snack. Obviously, if they're opened, I would say, make sure beforehand you prepare and put them in a plastic baggie. But it's, symbolic of birth as well. If you have some other treats that maybe are more expensive, like pistachios, let's say you don't normally get pistachios, you tend to have peanuts, bring the pistachios to a birth. And then having a couple bites of that can help you relax inside, have that little moment of peace. I mentioned journal or sketchbook. So sometimes When there's some downtime and you're letting the mother soak in her tub or talk to her spouse or, nurse her baby after the birth. So you may want to write a little bit, write some poetry if that's something that you do, or just journal about your situation and how you're feeling. And then finally, stretching. Stretching is a really good one because even one little stretch can make a significant difference in your mental health. The breathing, if you do about 2 minutes of the approximately 12 seconds for a happy thought, 2 minutes together for focusing on something positive, that can actually create new neuron connections. So put several 12 seconds together where you're focusing on a happy thought. Take a deep breath, focus on something positive, something that makes you smile. And you've got that 12 seconds, so at least count to 12. And then take a break and breathe, and then do it again. And when approximately 2 minutes is up, again, this is 2 minutes. You can do it in the bathroom break, you can do it when you walk outside, but just having that can make a physical difference in your brain connection. Focusing on your senses. So the next slide we'll talk about mindfulness. Focusing on your senses includes mindfulness as well as grounding, knowing that you are able to ground yourself in any situation. Taking a deep breath through your nose, count to 4, hold for 2, and then exhale for 6 through pursed lips. Mindfulness is essentially your ability to be fully present, aware of what we're doing, what you are, not to react to things around you, just being able to be. So take a moment to practice mindfulness. Look around you. Name 5 things that you can see. Notice what they are. What do they look like? What's their texture? What are their colors? Now close your eyes and name 4 sounds that you hear. Describe them. Think of each one. While your eyes are closed, try to reach around you. Name 3 objects that you can touch. It might be the chair you're sitting on. It could be your thigh in front of you. Maybe the ring on your finger, or the table that you're sitting near. Describe what the texture feels like. Then try to pick up on 2 different smells. Take a breath. Smell. What is it? How would you describe it? And then finally, what's one thing that you can taste? What comes to mind? You taste strawberry pie from this morning? Or the coffee that you were just drinking? Focus on what the taste is like. What does it remind you of? What does it make you think of? It's mindfulness activity. You can do it for yourself at any time. You can even do it with your client. Something that can help both of you. Now, it may help you also to have music. Just think of the types of things that you would suggest to your mom. Sometimes it's calming music that helps her through contractions. Other times it's pretty hard rock. What is your calming music? What is your safe space? So make sure that you're not at a time where the mom needs you. But just having some little music in the background sometimes, even if it's low, or some ocean sound sometimes, a lullaby, something that brings you peace. Music is amazing when it comes to mental health and relaxation. This is a tip I actually learned from a therapist years back. I have a little piece of chocolate. And years later, Dove commercial came up with something very similar, that moment. But it's actually based upon science. Chocolate does give you a natural energy boost. And then there's also an emotional connection, especially if it's something that you like, you know, maybe like a piece of, like the commercial, the Dove or Nestle's, or sometimes I like Ghirardelli. Just having 1 or 2 little pieces of chocolate in your bag, and you know, not depending on it all the time, but just using it when you need to. It doesn't necessarily have to be chocolate if you don't like chocolate. You know, like the Werther's commercial, you know, have like the buttermint or whatever that is. When you're feeling down, you need that little energy boost. And so that energy helps emotionally and physically. And then finally, it's nice to have somebody that you can call no matter what. So if you've got some time during the birth or after on your way driving home, it's good to know that there is somebody that you may be able to reach out to. Sometimes you are not able to find somebody who would be awake at all hours or who's open to having you call them at any time, and that's okay. There are other ways that you can reach out. You can definitely, as I mentioned before, the journal, write. When you need to say something, say it, don't wait. There are also apps where they allow you to check in at any time. This is something, again, that's helped my daughter, where sometimes she'll wake up in the middle of the night and she just needs to talk, and she has an app it's a mental health app that allows her to check in. And if you can just check in and say, you know, I'm having a tough time right now, and it'll give you something supportive, a suggestion for something to do to help you smile. It may give you a positive feedback on something, maybe an affirmation. But it's amazing how something like that can really help you get through a little hump, a little low spot, just to move on to the next. And be honest with yourself. You have a lot to juggle. Give yourself the respect that you deserve. That is vital. Try to develop or enhance your support system. Make sure you clarify your goals, even if it's just to yourself. What are you going towards? What are you shooting towards, right? Try to organize your day and make sure that when you organize it, you leave some room specifically for yourself. Maybe it's getting up a little earlier, or maybe it's something before bed. Maybe it's, you know, between clients. If you have prenatal set up for the day, have an hour in between to just have a little time for yourself. And then finally, be realistic and reasonable with what you can handle. Don't take on more than you can, because, you know, not only will it affect you, it'll affect your clients. In conclusion, mental health is about emotional, psychological, and social wellness. And just like physical health is not just the absence of illness, mental health is not just the absence of mental illness. Mental health is significant in your life because it affects your ideas, your habits, your emotions. This is why it's a vital component in your life. It affects your relationships with your clients, with your children, with your family, with your colleagues. It has an impact on all you do. And positive mental health can boost productivity and effectiveness. It can also help you adjust to changes in your life and help you manage stress. So yeah, this was a long presentation. The things that I want you to pull out of it are these top tips. Make sure you make time for you. Practice relaxation. Engage in activities you enjoy. Eat healthy, and set realistic plans and goals. Here are some resources. The Suicide Prevention Lifeline. You can use this for yourself, not just your clients. Always is available, even if it's 2 o'clock in the morning on a Sunday. PSI also has support not just for your families, but also for providers, for midwives and nurses and obstetricians that work with childbearing families. So you can call at any time. You can also text, and you can write an email the PSI office at postpartum.net if you have any specific questions. But again, reach out even if it's the middle of the night and you have questions, or you are going through a rough spot in the road, or you just had a very rough birth and you need to decompress and unwind and you need to talk to somebody. That's what they're there for. Here's